The paper is on perspective of handedness for high dexterity in the practice of ophthalmic medicine and surgery. So the purpose was to assess the perspective and what are the preferences in various experiences of ophthalmic sector people who are using their left hand and right hand respectively to perform routine clinical as well as surgical tasks, which has poorly been reported in literature before. So with that aim in mind, we did a cross-sectional study using the Google platforms, and demographic and practice questions pertaining to handedness was asked. The questionnaire was constructed by 4 people after a focus group discussion. The 4 people were actually different experienced people. One were less than 5, another was 5 to 10, another was 10 to 20 years, and another person was more than 20 years of experience. And there were 2 anterior segment and 2 posterior segment specialities, and then the questions include 22 sets. So this is a sample of the questionnaire that we arrived, labeling from age, current position, whether they prefer a right hand or a left hand, and how are they doing their common procedures like a cataract surgery, gonioscopy, if they use a right hand or the left hand, and a YAG capsulotomy, ranging from very common ophthalmic surgical and medical procedures. So the methodology was, the questionnaire was sent to 217 persons, out of which 203 people responded. It was a 1-week study period and it was a survey. And the operational diagnosis was right-handedness was defined as people who are using right hand habitually. Left-handedness were defined as people using their left hand habitually, and mixed-handedness who are comfortable with both their hands. So this was the results. Let us see it more deeply. And we are also asked, would you consider ambidextrity a necessary trait for ophthalmologists? That is, do you really prefer whether both hands is very important? The answer was predominantly yes. So then the statistical analysis was arrived, and the details of the trainee and the consultants were divided. And similarly, the ability of the participants to perform clinical tasks with one hand or both hands were evaluated for direct ophthalmoscopy, 90D, 20D, gonioscopy, slit lamp joystick, even foreign body removal, injection of OVDs in the eye, foot pedal in the surgery, which foot did they prefer for the phaco and the microscope, capsular excess, and irrigation and aspiration, especially if they are using bimanual. So among the 23 ophthalmologists, you can see here, 73 were trainees and 130 were consultants, and the number of women were significantly higher in the trainee group. A majority of clinicians, as you can see in the third line, considered themselves right-handed. So we had predominantly right-handed majority dominant surgeons in our specialty, at least in India, and the preference, you can see, the preference was a significantly lesser number of trainees, and clinicians with less than 5 years of experience considered themselves mixed-handed. That means there was a very minimal number of people who actually considered that they are using both the hands, so that they always preferred only a single hand compared to both the hands. That was the preference. The perspective, however, 174 participants considered that mixed-handedness was an essential trait, but they preferred that they should use both hands, but actually in the reality they were using only one hand. So there was a difference in the preference and the perspective. In this regard, however, there was no difference of opinion between the trainee and the consultant, that both said both hands has to be used for the surgery for a good performance in ambidextrity. So results, there was no difference between the groups in the perceived ability to perform common outpatient diagnostic procedures. That means the experience in terms of numbers mattered rather than the procedures done. That means more the number they were doing, more they were becoming comfortable with both the hands. So numbers were the only solution for developing mixed-handedness skill and cortical reorganization. In surgical procedures, clinicians who considered themselves mixed-handedness were comfortable in switching the IA between both the hands, and there was no difference for steps like injecting the OVDs or switching foot pedals. However, on the contrary, people who considered themselves both-handedness, mixed-handedness, they were not able to perform a fine maneuver like capsular excess with both hands. That was one significant point. So to conclude, mixed-handedness should be developed during the residency period itself. It's a very essential trait. So the sooner the better for cortical reorganization, so that you can see here mixed-handedness will always have its role, and conclusion was it is an indispensable trait in clinical practice as well as surgical practice in ophthalmology was the conclusion of the study, and these are my references. Thank you once again for the opportunity.